Can you imagine eating your favorite food and then all of a sudden you start experiencing excruciating, severe abdominal pain? Well, that's quite uncomfortable. Others may think it's just indigestion. But what if I told you something more serious? Don't worry, relax. I want to tell you about one health condition that you should not joke with. Yes, peptic ulcer disease. But before I continue, you know what to do. Click the like button, click the subscribe button, and turn on your post notification bell. Now, what is peptic ulcer disease? Peptic ulcer disease is just open sores in the lining of the stomach. Now, what brings about all these ulcers? It's just because of an imbalance. You know, your stomach produces acid, and this acid helps in the breakdown of food, helps in digestion. Now, if the amount of acid that is being produced by the stomach is too much for the lining of the stomach to handle, then what will happen is that the acid is able to break through the lining and then cause an ulcer. Now, there are a number of causes when it comes to peptic ulcer disease, but the commonest cause of peptic ulcer disease is by a bacteria called Helicobacter bacteria. Now, this bacteria lives in your stomach and is able to penetrate its way into the stomach, giving way and causing a burrow or a hole in the stomach, giving way for the acid to cause an ulcer. Our second cause of peptic ulcers that I want to talk about is continuous use of non-steroidal anti-inflammatory drugs, NSAIDs, short. Now, sometimes doctors can prescribe these medications because it helps relieve pain, helps control fever and all that, and so a doctor might prescribe these medications for these reasons. However, it's important to note that these medications can aggravate your ulcer. So once you have an ulcer and you take these medications, it can make it worse. One of the medications that people usually take is diclofenac. These medications can aggravate your ulcer. Now, here's the thing. Many people with ulcers don't even know that they have ulcers. And this is simply because the pain comes and goes. And so it's very easy to disregard it. So it's very important to see your medical doctor once you notice that you've been having persistent abdominal pain, especially the one that comes with nausea and then also unexplained weight loss. You need to get yourself tested. And by way of investigation, one of the tests that we usually do is the stool antigen. So your stool sample will be taking some chemicals added to it to find out if you have the H. pylori bacteria that we spoke about. Now, some people come to me and they say, doctor, I did the test, the antigen, the stool antigen test, I did the test and it came out negative, but I still have the abdominal pain. Now, it's important to know that the stool antigen test is not very, very sensitive. And so the gold standard for detecting peptic ulcers is the upper GI endoscopy. So with the upper GI endoscopy, a very long tube, that has a camera, a very tiny camera at the tip, will be passed through your mouth, goes through your esophagus and then down into your stomach, and then a small sample tissue from your stomach will be taken and then to be tested appropriately. That is the gold standard for detecting H. pylori bacteria. I'm sure you've learned a thing or two from this video. Kindly like, share and subscribe to this YouTube channel. But we are not done. In our next video, we'll talk about the specific signs and symptoms of peptic ulcer disease, and then we'll talk about how to manage it. I'll see you in the next video. Bye-bye.